Welcome to Lifestyle with Dr. Mobi. I'm Dr. Mobi, and today we have a great guest. Let's welcome Dr. Jamil. How are you doing, Dr. Jamil? Dr. Jamil is going to talk about today on alcohol disorders. Dr. Jamil is going to discuss alcohol disorders today. It is an important topic and we all can benefit from it. Dr. Jamil, stage is for you.
Hi, this is Dr. Ahmed. I'd like to talk about an interesting topic, alcohol use disorder. And I thank Dr. Mobi for inviting me to talk about this topic. Alcohol has been used in this world for thousands of years. And it only becomes a problem when it starts to affect our health, our family, our work. And just in the United States, our per capita consumption of alcohol is 2.38 gallon per year. And that's a lot of alcohol to consume. We produce almost 20 million gallon of alcohol yearly. There's some risk factors that will come up when you see somebody having problem with alcohol. You see them, they are drinking a lot and drinking pretty quickly. Sometimes they start drinking very early, even at age 15. They have almost 5-time risk of being alcoholic when they get older. So earlier you start drinking alcohol, higher is your risk for being problematic alcoholic in further down the lane. Female has less chance than man to be alcoholic, and depression, PTSD, ADHD, and childhood trauma all are risk factor for alcoholism. Globally, 1 million people are affected by disease. 1 in 10 children lives in a home with the parents are at risk. So how much is a moderate drinking? It is usually 1 to 2 drinks per man and 1 drink per day for women. And what does it mean, 1 drink? It depends on what kind of alcohol you drink. Like if you are a spirit drinker, that will be 1.5 ounce. If you're a wine drinker, it will be 5 ounce and 10 ounce if it's a beer. All contains same amount of alcohol, that is 0.5 ounce of alcohol. So how do you diagnose somebody that has alcoholism or alcohol use disorder? You'll know by the way they drink. They're drinking for a long time and in large amount. And they spend a lot of time looking for alcohol. And when they are not drinking, they are craving for alcohol. They are late at work, not doing well in the school, and they are spending more time looking for alcohol than socializing. And if they are not drinking, they are having withdrawal symptoms, which is pretty bad for some people, and that's why some alcoholic cannot stop drinking. If someone meets 2 to 3 of all the criteria I talked about, that is a problem. That is 14.5 million people in the United States, and half of them, and half of a million, or 250,000, will be age under 17. So this is a big problem. A lot of times family already knows about that something is not right, but they don't know what to do. Even before we talked about treatment, if somebody is drinking heavily, we have to worry about alcohol withdrawal. So you have to know how much they are drinking on daily basis. As this disorder is really a process of maladaptive learning and memory, we tend to do things which is rewarding. For alcohol is very rewarding, and they tend to go back to them to get the satisfaction. To treat people, you have to divide in two groups. One is mild, another is moderate to severe. For mild people, you can do some motivational counseling, structural group therapies like Alcohol Anonymous. Then we have 12 steps program. We also have smart recovery program. All works. And when I talk about motivational interview, it is a little different than other interviews. You have to make them understand what is important about quitting alcohol, why this is necessary, and what are the problems for these people that they are not changing. It is a learning process for the interviewer to get all this information. The motivational interviewing is to empower the person to find his and or her own solution, helped with the open-ended question, empathy, reflective listening or listening with empathy. People who lack motivation usually respond to motivational interviewing. For motivated person, they usually do better with medical treatment and behavioral therapy. Sometimes social service may need to be involved to assess patients' home situation and other support they need. Next thing, can you treat them with medication? There's few medications available. One is naltrexone. It is called Vivitrol. Is the drug of choice. But you have to be careful, can trigger alcohol withdrawal who is drinking heavily. And also can have a problem with liver disease like acute hepatitis and liver failure. So you have to do some blood work before we start on this medication. Alternative is Camprol. It works, but Vivitrol is number one choice. Other medication has been used is topiramate, disulfiram, gabapentin. All has less success rate than Vivitrol. So if possible, it is better to start the medication. For that, you have to talk to social service and the pharmacy service to see whether it is provided by the insurance company or not. Last few things that I can talk about. One is that alcohol or alcoholism, it is very difficult to quit. And people tried and fails. Failing is not uncommon. So you have to be persistent. You have to go back again and get the psychiatric help, psychologist help, behavioral help, medication, anything that takes. You go back and start again, because failure is not an option. Sometimes, under stress, people go back to alcohol. Or you met friends and you went to a place where you drank before. All of a sudden, you try to grab a beer or some other drinks. So it is very difficult to quit, and you have to be persistent always. If you fail, go back and start all over again. It is very unusual that somebody went through this protocol and did well at the first time. So failure is not uncommon. And for the family, you have to be helpful or be around them to support during this troubled time, because people do better when they have a family support. And at the same time, family will go through a lot of stress, and you have to believe that it's not your fault, and you have to do it for the patient. You have to believe that your loved one is responsible for managing his or her disease. You only can help. Thank you very much.
And thank you, Dr. Jamil, for coming and explaining in detail what it means and how to take care of alcohol disorders. Thank you.